Item 2. Clinical Portfolio. An accredited exercise physiologist is a professional who provides physical activity and behaviour change support for clients with conditions such as cardiovascular disease, diabetes, osteoporosis, depressions, cancer, arthritis, COPD, and many more. The scope of practice provides industry expectations and level of care that exercise physiologists follow to ensure clients receive appropriate treatment. 2.1. A pre-screening assessment such as the Adult Pre-Exercise Screening Tool, supported by ESSA, is one of a number of tools used at Melbourne Physiotherapy, Pilates and Fitness Group to assess a client's physiological baseline measures, medical history, family history and exercise history, while also considering the client's goals and readiness to make changes to their lifestyle. Despite substantial evidence supporting the long-term benefits of regular exercise, about one half of Australians do not meet the recommended physical activity guidelines, contributing to decreased quality of life and ability to perform activities of daily living within the population. The importance of thorough screening and evaluation will demonstrate major signs and symptoms suggestive of cardiovascular, pulmonary, and metabolic disease. With or without established cardiovascular disease, exercise, both aerobic and resistance, has demonstrated to manage and significantly improve functional capacity, as well as have favourable outcomes in the prevention and management of musculoskeletal injuries, preventing falls and postponing reduced physical functioning associated with ageing. Artifact 1 is the adult pre-screening tool, often used for an initial assessment at MPPFG. The benefits of this tool are that it can outline some significant risks associated with their current lifestyle and highlight to the client any unknown or ignored habits that contribute to increased CVD. This tool also allows them to establish some achievable and sustainable goals, which can then motivate the client. This is done with the assistance of a practitioner. 2.2. During my placement at Rise Health Group, there was a number of assessments used to evaluate how efficient and effective a client could move. However, following a pre-screening tool and gaining an understanding of their history, most clients were talked through and judged on their ability to perform the functional movement screen. Although the FMS is most commonly used among the athlete population, it is a valuable tool used in a clinical setting as the term functional has significant meaning, providing important information throughout an assessment in relation to functional mobility and postural stability for everyday activities. During the assessment, poor neuromuscular control, movement asymmetry, and muscular imbalances are evaluated, scored, and then predetermine the client's future exercise or rehabilitation program. Using the FMS for assessing movement capacity has been deemed reliable, both repeatable and reproducible, with an intra-class correlation of over 0.8, with good reliability of 0.76, using the FMS between different observers, making it an excellent choice for an assessment of movement. Artifact 2 is an example of a FMS evaluated on a 12-year-old female pitcher, presenting with known shoulder pain that was being treated by physiotherapists at Rise Health Group. Her primary intentions were to improve her game endurance, overall strength and conditioning, and prevent any underlying conditions. From the FMS, it became evident that the client had poor shoulder and hip stability, reduced neuromuscular control leading to inefficient segmented movement, and studies suggest that athletes should lead from the hips when pitching to create and maximize lower body power and drive to generate ball velocity. 2.3. An individualized exercise program can be developed to tailor and fit client-specific needs. While the benefits of exercise are known, motivation and motives are important determinants for rehabilitation adherence. Special consideration needs to be made when developing a program to achieve the client's desired outcomes. Different clients and conditions will demonstrate substantial differences in ability and capacity. For example, a client with osteoarthritis or chronic knee pain may exhibit such physical characteristics: obesity, poor lower extremity alignment, knee instability, structural damage, pain tolerance, fear, or anxiety, leading to different responses to exercise. This supports the theory that tailoring exercise programs to the individual needs of a client may improve treatment outcomes. Artifact 3 is an example client program with SOAP notes designed while on placement at MPPFG. Client X, 37-year-old female who sustained a serious injury to her knee, resulting in numerous fractures causing patellofemoral maltracking, and is currently undergoing rehabilitation to delay the joint replacement surgery she's most likely going to have to get. The client has developed high blood cholesterol, which her GP attributes to her less active lifestyle, compared to her previously vigorous, active running and cycling activities, in conjunction with poor dietary choices. Primary goal for the client is to reduce the degeneration of her knee joint by strengthening the surrounding muscles and thus improve the likelihood of the client returning to a physically activity lifestyle without pain and being able to complete work tasks. Outlined on this slide is her history, training goals and home program, as well as her SOAP notes. 2.4. While undertaking placement at MPPFG, a client was referred by his GP for physiotherapy to control chronic back pain and EP sessions to initiate a more physically active lifestyle of exercise and healthy eating. Client Y was initially assessed chronic back pain, hypertension of 171/117, and waist and hip measurements 139 and 131 centimetres respectively were of serious concern. Australian guidelines suggest that if systolic blood pressure is greater than or equal to 180 or diastolic blood pressure is greater than or equal to 110, then exercise should be suspended. The client revealed that he had not taken his blood pressure medication for a couple of days, resulting in the high reading. It was recommended that he went straight to the pharmacy with his script to receive his blood pressure medication. Taking into consideration exercise guidelines for severe hypertension, we assessed 30-second bicep curls, sit to stand, and balance tests, keeping an eye on shortness of breath and back pain. Artifact 4 is the initial assessment and recommendations made, along with an exercise program. Simple dietary advice was given to the client, and it was also suggested that the client meet with the practice dietitian to assist him in developing more strategies to assist him in reaching his health goals. After gaining an insight into the client's diet habits and inactivity levels, it was expressed to the client that there is an increased risk of developing type 2 diabetes and serious cardiovascular complications if changes are not made. A diet including a reduction in sugary beverages, a reduced total and saturated fats, and increased fruits and leafy green vegetables in conjunction with weight reduction can significantly reverse associated morbidities. Therefore, increased physical activity and complementary weight reduction will improve health outcomes. The client admitted to drinking 1 or 2 bottles of red wine on Fridays and Saturdays, so effort was made to reduce that to a glass or 2. Although light to moderate alcohol has beneficial effects on HDL-C levels on the heart, individuals who consume 3 or more drinks within 1 to 2 hours have increased CV mortality risks, and the client was not aware of this. The client was meant to begin PT sessions in 2 days' time, but was recommended that he postpone these sessions until his blood pressure was under control and within safe limits to exercise. 2.5. It is essential to communicate with the client the associated risks that are likely to occur due to their change in lifestyle, especially considering their family history. There are modifiable risk factors such as tobacco use, hypertension, obesity, diabetes, physical inactivity, and dyslipidemia, as well as unmodifiable risk factors such as male gender, family history, race, and increasing age. It has been demonstrated by numerous studies that although we can't change unmodifiable risk factors, if we initiate positive changes to modifiable risk factors, CVD, morbidity, and mortality can be considerably reduced. Artifact 5. Client Z is a great example of an exercise intervention and education regarding modifiable lifestyle changes. Client Z is a 44-year-old female, a stay-at-home mum and carer. Previously engaged in exercise classes up to 3 times a day, now cares for someone at home and drives her son, who's an elite swimmer, to and from training. Due to her change in lifestyle and reduction in physical activity, Client Y has gained 20 kilograms in the past year, with considerable adiposity around her stomach. Family history of heart disease and premature death in both parents have occurred in their 60s, so her goal is to reduce her weight by 20 kilograms. After the initial assessment, Client Z's CVD risks were highlighted and was encouraged to make some positive changes to reverse the modifiable risk factors, such as being able to find opportunities to exercise. This may be while she waits for her son at swimming training. A home program was designed as she could not afford to engage in consistent sessions with an EP due to her family commitments. Contact via phone or email was further encouraged if she had any questions or difficulties regarding the program. This resulted in Client Y emailing with a list of excuses as to why she couldn't complete the program. It was then emphasised that if Client Y was expected to care for others, it was important for her to look after herself first and make her health a priority to avoid future cardiovascular events. Following the client's goal to lose 20 kilos, it was further emphasised that her increased levels of adipose tissue contributes to her increased risk of atherosclerosis and type 2 diabetes. However, associated weight loss therefore improves endothelial function and enhances insulin sensitivity, thus reducing these risks. 2.6. For the treatment of a client with type 2 diabetes, exercise is considered beneficial in conjunction with dietary modifications in improving glycemic control and preventing the development of atherosclerosis, as there is an increased risk of CVD in diabetics. A study performed by Van Dijk and colleagues suggests that 30 minutes of daily activity is just as effective as 60 minutes of exercise performed on every second day to enhance glycemic control. Furthermore, it was demonstrated that pharmacological treatments, including oral medication and injections, do not provide sufficient enough protection against hypoglycemia, leading to encouragement of exercise being used as an excellent intervention. A combination of aerobic and resistance exercise is prescribed to the client due to both types of training demonstrating to improve insulin sensitivity. In addition, resistance training is shown to not only improve acute insulin response during glucose tolerance testing in diabetic men and women, but it also improves insulin sensitivity during hypoglycemic events. Artifact 6 represents the exercise program for Client A. Her training goals are obviously to manage her type 2 diabetes and prevention of CVD. However, it also provides a social aspect for the client while improving her functional capacity, quality of life, and her longevity of independence. The program begins with a total of 15 minutes aerobic training, followed by a circuit-styled resistance training program, and then finishing off with some balance work. 2.7. The ultimate goal when working with a client following a total hip replacement is to reduce pain, stiffness, and improve physical function, as well as develop a program with a focus on improving strength and stability. Post-surgery, strengthening the muscle stabilizing the replaced joint is paid considerable attention to, especially the gluteus medius. The gluteus medius controls leg abduction force and lateral stability to the trunk and pelvis during walking and single leg stance. It is also encouraged that clients enhance in a home exercise program following a total hip replacement, consisting of hip flexion, hip range of motion, as well as low resistance strengthening exercises for hip abductors, flexors, and extensors. Studies imply that home programs have contributed to improve strength and stability, stabilizing muscles, walking speed, and functional ability. Artifact 7 is the client's home program following a total hip replacement, with particular focus on gluteus medius activation. The client is now 6 months post-surgery, and weekly EP sessions are usually modified depending on how the client feels and what areas need to be addressed. 2.8. This year I've engaged in 2 separate placement opportunities, which were both voluntary, one at Rise Health Group and the other at Melbourne Physiotherapy, Pilates and Fitness Group. At these locations, I was exposed to all levels of healthcare in a population level. Primary prevention, where the aim is to prevent disease or injury before it occurs. For example, using the functional movement screen to identify physical and functional weaknesses and detect any specific areas that may contribute to future injuries. Secondary prevention, where the aim is to reduce the impact of a disease or injury that has already occurred. For example, my delivery of an ACL return to sport program, as well as the ACL speed and agility session. Both programs focus on strengthening all of the muscles supporting the ACL and giving the client every opportunity to return to fully functional capacity. Tertiary prevention, where the aim is to soften the impact of an ongoing illness or injury that has lasting effects. For example, working with the Stay Strong exercise group who either have type 2 diabetes or a cardiovascular condition. One client in particular is 91 years old who suffered a stroke and has a pacemaker. Exercising is difficult, and it is crucial to keep an eye on the client's oxygen levels, blood pressure, and heart rate while exercising. With an ongoing condition, the goal is to ensure the client is safe and does everything possible to avoid future cardiac events. Thank you for listening to my presentation.